If you're taking the NBCOT, stop scrolling because this is the one thing you need to know. Welcome to part 1 of my NBCOT Must Know series. Today we're going to break down the Glasgow Coma Scale. To start off, what is the Glasgow Coma Scale? The Glasgow Coma Scale is a standardized neurological assessment used to measure a person's level of consciousness. It's commonly used with individuals who have experienced a traumatic brain injury or other neurological injuries. I've purchased and used plenty of NBCOT resources, and for this particular topic, I'm using a sheet from OT Help Desk. So let's get into it. The Glasgow Coma Scale looks at 3 things: eye-opening response, verbal response, and motor response. The easiest way for me to remember is look, talk, move. So you have 4 points, 5 points, and 6 points. First, we're looking at eye-opening with a maximum score of 4. Highest score would be spontaneous. They can open their eyes spontaneously. What does that mean? That they can open their eyes without any stimulation on their own. An individual would score a 3 if they open their eyes to speech, to somebody speaking to them. They would score a 2 if their eyes open to feeling pain. And they would score a 1 if there is no response at all, meaning they don't open their eyes. So the way you can remember it is on their own, voice, pain, nothing. The more stimulation a person needs, the lower the score. Next, we're checking their verbal response with a maximum score of 5. The client would score a 5 if they're oriented to person, place, and time. They know where they are, what time it is, and who they are. They would score a 4 if they're confused. The person would be able to communicate verbally, but be super disoriented and not know what's going on. A score of 3 would mean that they're able to communicate but with inappropriate words. The words could be completely irrelevant to the conversation and unrecognizable as well. They would score a 2 if they produce incomprehensible sounds. What that means is that they could groan or make noises but not really communicate verbally. And obviously, if they score a 1, that means that there is no verbal response at all. So you're going from somebody who is oriented to knows what's happening to someone who's confused to words to just sounds and nothing. Last is the motor response being the highest scoring category. A person would score a 6 if they're able to obey commands, such as squeeze my arm or touch my nose. So 5 and 4 could be a little bit confusing because they're very similar, but let's break it down. An individual would score a 5 if they know where the pain is coming from. Let's say somebody is hurting their leg. They know it's coming from their leg and they will try to remove their leg so they don't get hurt. A person would score a 4 if the person knows that they're in pain, but they don't know that it's coming from their leg. So they would score a 5 if they can localize pain, and score a 4 if they can withdraw from pain. Would score a 3 if there is abnormal flexion present. This is also called decorticate posturing. All that is that the arms flex toward the chest. They would score a 2 if there's abnormal extension. This is called decerebrate posturing, which is basically the arms extend and rotate outward. And 1 being obviously no motor response. So remember, the client starts off obeying the command, finding the painful stimulus, withdrawing from the painful stimulus, flexing, extending, and then nothing. Now let's discuss the total score. What you're going to remember is that anything below 8 is severe impairment of consciousness. You would sometimes hear the word intubate with somebody who scores anything below 8. However, in actual clinical practice, it varies from client to client. Airway management really depends on the individual's personalized condition and not necessarily based on the score of the Glasgow Coma Scale alone. A score of 9 to 12 would be moderate and 13 to 15 would be severe. So think, the higher the number, the more alert, the more oriented, the more motor response, and the more okay a person is. And that's the end of part 1 for NBCOT Must Knows. Save this for your boards and follow so you don't miss part 2. Thanks for watching.